the Registrar of the Liberian Board of Nursing. They both are here, and we have several issues we're going to be looking at, from the code of conduct for medical practitioners to their involvement in the fight against COVID-19. These are issues we going to be looking at on the program. So I'm sure you out there, you just need to now start jotting down your questions. If you want to make comments, you will have the opportunity later on the program to do that, recommendations as well. We will have all of that coming in from you on the program. So Madam Dr. Birch and Madam Flomo, welcome to the Bomber Show. Welcome to ERBC.
Thank you. Thank you.
So, really, I want to start from, just get the ball rolling right away. When we talk about the code of conduct, we know every profession has a code of conduct or code of ethics, whatever they might call it. But when we talk about the one form for medical practitioners in the country, how will you like to make people that are listening to understand what do we mean by the code of conduct when we're talking about it from the medical standpoint?
Thank you very much. Let me just give you a brief history on how we came up with the code of conduct for health professionals within the Republic. It was in 2013 or 2014. Given the complaints that were coming in from health facilities concerning health workers' conduct, the health workers were punished, but there wasn't any fixed guideline that we would follow, anything documented.
Okay.
It was based on that the Minister of Health at the time, Dr. Tan, decided to set up a committee to draft the code of conduct for health workers to address all of the issues that were coming up at the time. She set up that committee and suggested that LMDC, being a regulator, should head that committee. The LMDC decided to call heads of all the professional boards, Liberia Nursing and Midwifery Board, the Pharmacy Board, the Physician Assistant Board, Complementary Medicine Board, all the health professional boards. They came on board and the document was drafted. It was validated, but the funding was solely from the Ministry of Health. But then after the document was drafted, it was just sitting there. We needed money to print the document and disseminate it to the health workers. It was not until I took over the LMDC in 2017, realizing the same complaints coming from the field, and I remember that this code of conduct was drafted. We decided to look for funding, and through the help of WAHO sponsored us. We did the printing. We printed, I think, 25,000 copies of the code of conduct, and they even supported the dissemination. It was launched in April 2019. And you'll be surprised to know that since we launched the code of conduct, we have seen some impact.
Okay.
For example, the number of the number of cases coming into our offices as it relates to the conduct of health workers kind of reduced. So it's still coming, but compared to before, that number is gradually reducing because people now are aware of what the penalties and everything associated with their misconduct.
Okay.
Also, we have been able to reduce the number of advertisements from traditionalists around in the various radio stations. We have been able to reduce that number of advertisements through the code of conduct. So we can see that we are getting there. Gradually, we'll be able to overcome all the hurdles that surround the whole as it relates to the conduct of health workers. So this is how this gave birth to the code of conduct.
So, ma'am, I'm sure that there are several, malpractices that, the complaints were coming in, which led to the establishment or the drafting of this code of conduct. But medically, or for medical practitioners, when we talk about malpractice or malpractices, what are some of the, things that are associated with that? And besides, what are the ones that are, most common in health facilities or among health workers?
Okay, first let me just briefly state what malpractice is all about. It's simply a violation of the standard of care.
Okay.
Let me put it that way. That is, a patient comes into a health facility, you should follow certain standards. Vital signs must be taken before you administer IV fluid. You should do blah 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 blah. So that standard of care must be any breach in that standard of care is malpractice.
Okay.
It could range from medication error, dosage error, misdiagnosis, you name it. Any violation in the standard of care that results into injury or death of a patient is considered malpractice. Simply that's what it is. And like any other nation, Liberia too, we have cases coming in, cases of malpractice, medication error. Sometimes even the conduct of the health worker approach to the patients, which is very, very important, because when you establish that patient relationship, once it is established, even if things go wrong, the tendency for the client to want to take it further, it minimizes. We all make errors, but our approach to the issues is what aggravates or solving the situation. Let me put it that way. So we do have cases of errors in medicine, and the state of the code of conduct. In first, let me just tell you the code of conduct. It has to do with the dress code. Every health worker should follow the code of conduct to tell you exactly your dress code.
That's
a medical doctor.
That slippers they can wear, is it? Is
Yes,
it part of
it
it?
depends on I don't know exactly what kind of slippers
Because I
you're
can
talking
see
about.
some of the special design slippers. I always see nurses wearing that
Okay,
slipper.
yes.
So is it?
Yes, you can wear that. You can wear the slippers. It doesn't
Okay.
matter.
Okay.
You have to be properly attired in your lab coat. The nurse is supposed to wear the white suits, whether it be a dress or a trouser suit. It must be white, and they should wear their cap. If a nurse doesn't have her cap on, she's not completely attired. The name tag should be the patient, the health worker should be identified by your name tag. We shouldn't even ask you with your profession attached to it. That's the first thing. Your dress code. Your license must be updated. We don't want people with expired licenses.
Okay.
The next thing we look for is the license. It must be updated. Also in the code of conduct, address the issues of malpractice, what the penalties are. If you do X, what the penalty. Now, it is not a one-shot thing that if a person, a complaint filed against a health worker and you go this, it just has to be, we depending on the intensity or the gravity of the situation, it could range from fines to suspension, dismissal, revocation of license, or even deportation if it's a foreigner who's involved.
I want to know whether the nursing board has revoked any license, the license of any health worker since the establishment or the institution of the code of conduct.
I think I will let the representative from the nursing board speak to them.
Yeah, man, you can talk about that.
Yes, there have been different kinds of disciplinary actions taken against nurses and midwives, and as Dr. Birch said, it depends on the gravity of the situation. Because like she just said, malpractice comes in different form, and your reaction to what happened with your interaction with the client, or we call it your patient, counts a lot. And like you said from the beginning, the medical, the nursing, the midwifery, and other professions have this code of conduct, which is a set of guidelines that the Birch has already said it, that establishes an acceptable behavior for every step you take in the profession. So I called it the foundation for your profession. It has been around since all of the professions were established. Therefore, the code of conduct, the rules and regulations that govern the profession, tells you exactly how to go about the profession. That's the uniqueness about the medical, the nursing, the midwifery, the physician assistant professions, because you have a set of guidelines. You are not just entering it blindly. You are entering it with a mind of service. And the code of conduct also has different elements.
Sure.
And if you come to the medical, the nursing profession, it tells you one of the major elements is the nurse, the midwife, the doctor, and the person, or we say, and people. Our profession calls for daily interaction with people in the environment. And one of which you have to stand by is the respect of values and dignities. And if you cannot go according to that, respecting him of values, now then we have breaches in your practice. And then when you have those breaches, we go through as regulatory agencies or bodies in collaboration with the Liberia Medical and Dental Council and other regulatory bodies based on which entity you are directly on, we start to look into the issue. How did it come about? We also have the profession and its practice. You must be guided by the practice for which you took oath. And that practice is simply telling you practice according to how you were educated or why you were licensed. So if you just left why you were licensed or your education and move into another practice, is also another breach. So there are different malpractices, and whenever you miss one step, like Dr. Birch said, you go into another crisis.
Definitely you could. But I'm sure you've heard about, numerous complaints about people turning away, health facilities turning away patients because sometimes they don't have money or other reasons best known to them. But is it ethical to turn away your patient, whether that patient has money or not? Yeah, anybody can respond to that.
Well, when it comes to health, money shouldn't be your priority. You have to look at the patient's condition. A patient comes to you because a patient needs care. The money can come later. We can discuss around how the money can be paid. No one will agree, especially as a regulator, for a patient to be turned away by health facility. That shouldn't even be. But given our society, these issues have been identified already. And we are in the process of trying to address them. It takes the collaboration of everyone to address the issue. Because in the first place, no patient should be turned away. You first have to see what you can do to stabilize that patient to move on to the next level. Now, if you look at the requirement to open a health facility, there are certain requirements we have to meet. And one of those requirements for a clinic, every clinic must have the next level of referral. That should be in your emergency room with the telephone number.
Okay.
But if your next level of referral is not even near you, maybe you're somewhere far away, and it takes hours to get to your next level of referral, you need an ambulance. Your next level of referral may not even have an ambulance. That's the first thing. So you see, patients will be turned facilities will turn away patients because they don't even have the means of transporting the patient at the first thing. These are issues that have been identified. But right, that health facility should call the next level of care. Look, I'm bringing patient X, give you a brief history of the patient before the referral. By the time the patient gets to the referral center, the people are already waiting for you. That's ideal referral system. But then again, we have a lot of challenges. The issue of ambulance. Sometimes you have the ambulance, you have inadequate number. You have inadequate number of ambulances. The issue of maintenance of the ambulance, fuel. Sometimes the question is no fuel in the ambulance. So all these are issues we have identified. The good thing about it, we have already identified where the issues are in the health system.
Okay.
And so we're trying to work along with all the professional bodies, including as well as the Ministry of Health, to see how we can address referral issue. Because before you address referral issue, all the hospitals have to come on board and buy into it. Yeah. You can't just make a blanket statement. No patient. No. People should sit around the table and suggest how to address it.
Okay.
Once people are part of that decision making, the tendency for turning away patients, I'm not saying it will stop, but it can be reduced.
You know, you spoke about doctors or nurses being licensed, and that should be regularly done, renewed for over a period of time. But I'm concerned, who does the licensing of these, nurses, and what's the requirement before a health practitioner can be licensed to operate as, health practitioner under in the Liberian jurisdiction? What's the requirement?
I will speak mainly only for the doctors because LMDC issue licenses to doctors and dentists. For the other professions, it's their professional boards, like the nursing and midwifery board, they issue license to nurses and midwives. The physician assistant, the physician assistant board issues license to them. The pharmacist board issues license to them. The traditionalists, we have a little problem when it comes to traditional medicine because we have Ministry of Internal Affairs giving license to herbalists, Ministry of Health giving license to herbalists. We still have not been able to harmonize it. We are still in a harmonization process on who issues license to herbalists. So we are still discussing, that is still ongoing. For the doctors, you must have graduated from a recognized institution and certificated that you do have an MD. Or whatever specialty, you must present something that proves that you have graduated from this institution. If it's not in Liberia, the medical and dental council functions through committees. We have our ethical committee. We have so many committees there. So we work through these committees. Your credentials are presented to the committees. The committees call you in after they have reviewed your documents, and they do follow up. You get in contact with the various schools if you're from abroad. They get in contact with your school. If they cannot get the school, you have to tell the ethical committee how to get in contact with the school. If all of your documents are okay, depending on your level, if you're a specialist, we grant you your license once you have met up the requirements. For a GP, you will have to do 1 year internship in Liberia, where you are evaluated by doctors in the hospital. If you are cleared, the ethical committee will look at your performance report, and they will decide whether the license can be issued or not. Whether you have to repeat the internship. For the license, for the nurses, Madam
Flomo.
Yes,
Okay.
that's a good question, trying to establish the authority by which people get licensed, because there are too many fake ones around. And by law, like Dad said, the Liberia Board of Nursing and Midwifery was passed into law in 1948.
Wow.
With that legal responsibility to recognize accredited nursing midwifery schools. I'm starting from the training background because before you become a nurse or a midwife, you have to be trained. So our role is to accredit the training institutions. And after your graduation, as long as you graduate from one of our accredited institutions, not just any training institution, your school sends us your name, that you have met all of the school's requirements and you are now qualified to sit the licensure exam. And that exam by law is administered twice a year. And then after that exam, when you pass, you are given your license. And the license runs for 2 years. After 24 months, you come and renew. So we license all basic from high school to nursing or midwifery school. Post basic, you have your first license and you want to advance or specialize in the nursing and midwifery areas.
Okay.
So when you go to any hospital, like Dad said, that license or need time, depending on the protocol at the hospital, but we require that every nurse has his or her license during the working time, because you have the right to ask, because a nurse or midwife or a doctor should introduce the first step interacting with you. My name is Cecelia Flomo. I'm a nurse, my license, and I'm going to be dealing with you in this department as your nurse, as your midwife. Any question?
All the time. That was supposed to
all of the time. The protocol is to engage a client. You must introduce yourself. He or she has the right to know who is dealing with her, and even have a consent. You must seek. I must seek your consent. Are you confident with me? Can we go ahead with your process? Yes, I do. And you people continue. That's part of the standard in treating or meeting your patient. So we do it.
I want you to talk a little bit on the issue of midwives, because there was a time I heard that, you know, because they usually deal with people in the rural areas, and when the issue of, child mortality, maternal mortality, I'm sorry, was very high.
Yeah.
There was a time it was instructed that no midwife should deliver any pregnant woman at home. Pregnant women should be delivered at a health center.
Yeah.
So is that still in force today, or we still have midwives delivering women at home?
Midwives are trained to do delivery.
Okay.
And wheresoever a midwife sees a delivery that spoke about emergency, that midwife can intervene.
Okay.
They have that professional authority to do delivery.
Whether at home or not.
if the emergency, if they meet this emergency at home, this woman, and they have to rescue her life, it's not, their home is not the facility.
Sure.
It's not a facility. DC will tell you to do practices at home. However, when there's a need, what the country was speaking to had to do with the traditional birth attendants.
Okay.
We do have traditional birth attendants.
They are different from midwives?
They are different from midwives.
Okay.
They are different from midwives that are schooled to do delivery. So those people can do delivery in any setting with their professional background and the supply. But the trained birth attendants are people who traditionally, should we call it apprenticeship that?
Are they the one they refer to as a trained traditional midwives?
Yes.
Okay.
No, not the ones that are schooled from accredited nursing, midwifery school.
Okay.
The trained birth attendants are our traditional leaders that have been there and they have learned by seeing or watching others do. And they want to help in a way, but then the law was saying you cannot keep doing it at home. Move with this patient at the facility. There where you have the trained midwife. And that trained midwife can conduct the delivery because he or she was trained to do the delivery.
Okay.
So that was the issue about the traditional birth attendant. That just spoke about traditionalists, herbalists trying to come and do some medical practices. So we were strongly speaking against deliveries being conducted at home because we were all finding reasons why our maternal mortality was or is, because it's still high.
It's still high.
It's very high, yeah.
Okay.
Yeah.
That I want you to school us a little bit because I've been in some conversations, and sometimes people, because we interact with these medical practitioners on a daily basis, they are somehow confused. They don't know the difference between a nurse and a physician and a doctor. You know these different names in the medical field and probably the kind of work they do. So just for the benefit of our listeners and probably those who still don't understand this, can you just take off a short while to explain the differences?
Different cultures
Yeah.
of health professionals.
Mm-hmm.
It's very good that you ask this question because for our people, anyone who works in the hospital
See, doctor.
is a doctor. And that issue is addressed within the code of conduct.
Yeah.
That everyone's supposed to have your name tag with your qualification. If you are an MD, your name is MD. You're a specialist, your name will your area of specialty.
Yeah.
If you're a nurse, RN or BSc nurse, it's there. Your PA is there. So that has been addressed by the code of conduct. Now most of our people don't read and write. You get in the hospital, in every cadre or health professional, if you read the code of conduct, your dress code also somehow different.
Mm-hmm.
The doctor will be in a long coat, long sleeve, white coat. The laboratory technician will be in a coat, in a long white coat as well, when he will have their lab. The midwife, she will be in her navy blue and white dress. The nurse is supposed to always be in white.
That's it.
Your nurse is supposed to be in green. So if you look in the code of conduct, it's addressed. So the colors, the physician assistant will have a coat, but it's not long sleeve, it's short sleeve.
Yeah.
So everything is spelled out in the code of conduct. Yes. So by the dress code, you should be able to identify these people. No cleaner is supposed to be wearing white coat in the hospital. No.
So who's the first person, let me put it that way, that a patient interacts with when you enter the hospital or enter a health facility?
The first person the patient will encounter maybe will be the record. It depends on
the environment, the system.
What the patient, the condition in which the patient enters.
Okay.
Because if the patient enters in an emergency situation, going straight to the emergency room. you're going to meet professionals there. You're going to meet nurses, you're going to meet PAs. Maybe the doctor may even be there at the time they arrive.
Yeah.
If the doctor is not there, the doctor is called right away. If you go into the hospital on an outpatient basis, that is, you come to the hospital, you are examined, you are diagnosed, you are treated, you go home. On an OPD basis, the first person the patient will meet is the registrar, a recorder, or maybe the cashier, or the receptionist,
All the security etiquette.
or the security that will
Everyone's fine.
auction
Yeah.
him or her into the health facility. So it depends on the condition the patient arrives in at the hospital.
Confidentiality is something that has been causing widespread, concerns in recent time. People go to hospital, they, go through medical. Later on, their case is heard outside. If we talk about confidentiality and the fee of nursing, I know there are specific punishments for, say, penalties for any disclosure of someone's medical records. But what are some of the punishments or say penalties associated with that?
It depends now. That's what I'm saying. Violation of care, standard of care, confidentiality is enclosed
Okay.
within standard of care. Record taking patients' information is enclosed within standard. It's just a broad term. All of those are embedded in the standard of care. Now, if you breach the confidence of the patient, and it depends on the injury or whatever may result as a result of your breach in confidentiality will determine the action taken against a health worker. Because you could give information that maybe the person is seeking a job, seeking employment, and the person has a condition, and the nurse happens to relay that information to the employer, and for that reason the person thinks that he or she was denied employment because somebody let out the information. So it depends on the gravity of the harm to the patient. That will determine the next course of action.
Okay, so you're listening to the Bumper Show here on ELBC Radio. We're talking to the chairperson of the Liberia Medical and Dental Council. She's Dr. Linda A. Birch, and we also have Cecelia C.K. Flomo. She is the Registrar of the Liberian Board of Nursing and Midwifery. We're talking about code of conduct. We're talking about other issues surrounding the health profession in Liberia. So we will open the lines now. You can call us on 088, that's 080-514-096, 0776-089-713. Call those numbers, ask questions. You can put your recommendations through on the program. Let's hear from this person. Hello? Hello? Okay, we just can't get that person, but like I said, 080-514-096. You can call. Hello? Hello? Okay, let's hear from this person. Hello? Hello? Okay, let's probably having some problems with this line, but we will settle that very shortly and start to take your course. But man, if you want to respond to this question, you can go ahead. If you don't, yeah, you're not compulsory. But recently you were instructed by the president to do an investigation, and you went through that. The president now is promising to implement that the recommendations from this report. So, what new or what do you think would change with the implementation? You don't have to disclose what's in it, but what do you think would change when the recommendations contained in this report is implemented?
I'm sorry, I don't want to comment on that. Please.
Okay, ma'am. Thank you so much. So keep your calls coming in. 0 Hello. Yes, hello.
Hello, are you getting?
Yes, you live. Tell us your name and where you call from.
Jarp Davies. Sorry, I put the
All right, let's hear from you.
Well, I have a question for her. I mean, the question I have to know for the partition in the general benefit. Where are those they can be there putting the place on? They come they want to then things they can take.
Hello? Hello? Hello?
Are you getting me?
Yes, we get you. Please take your time and say your question. Please take your time and ask this question. We need to understand you.
Yes, one, I just say, where are those that they are putting together for standing and now and then they get for those parties, they are in a they are working. What now? Okay, so they were because they go nobody to they want so one in the drug relationship and when you must go from measure. We have parents that see the name of our community. If somebody has to see community and the what they give highway they want to appoint to us when the project is supposed to they want some in it.
Okay, so let's hold you there, but I'm sure you understood the first one that the caller is asking about compensation for these midwives that are in the various villages. They are not on payroll, but how are they getting compensated for the work that they do? Who's responsible, in fact, to remit to them?
When it comes to compensation for traditional midwives, that has to do with the Ministry of Health. We are regulatory. We are a regulatory body. Those are human resource issues.
Okay.
And we enforce more on our leadership. So the Ministry of Health will be able to answer that question.
Hello?
Hello?
Yes?
Thank you very much. I'm Dr. Suarez calling from East Georgia.
Welcome, Doc.
Yeah, thank you. I want to thank our studio guests for their brilliant explanation on how we should govern ourselves as medical practitioners. And I have one of two questions, and that's one that advice. That is it possible that the code of conduct which approach we are just talking about is approach is the basis of most of the discussion and can that be taken to the institutions?
I think he's speaking about the license.
Get it. Oh, sorry.
Yeah, getting
Oh,
the license
for
because
2 years.
yeah, after 2 years before it's
Oh,
renewed.
sorry.
Yeah.
Oh, sorry.
And he also spoke about you introducing the code into medical institutions.
That,
Yeah.
that had, in fact, when the code of conduct was launched, the training institutions were invited.
Okay.
Some of the training institutions took copies. The TNIMA, I remember they said the TNIMA. I'm not sure about others. There were several of them that were present because they were all invited. All health training institutions, all health institutions, particularly in Monrovia, they were all invited. It was advertised on radio. So yes, we do acknowledge the fact that it's supposed to be also taught in schools.
Yeah.
So that has already been taken care of. We have already communicated with some training institutions, and even those we continue to reach out to them. We still have copies, and we'll still continue to reach out to them.
So you want to make it as
them.
a course in medical schools? Is that what you're saying?
That course per se, but it can fall under under one of your curriculum. It can fall under maybe in medicine. Maybe you can fall under medical jurisprudence or so, what have you.
Yes.
So if you have courses in the training institutions, you can just look at the course.
Also, many thanks to your studio guests. They're very sound and knowledgeable. But I hope my question is in line with why they are in studio, and that is about drugs. Expired drugs in our various hospitals, drugstores, and other places. And number two, COVID-19 is killing a lot of people around the world. And I heard from medical practitioners that people who already have pre-existing cases, like for example, David Coty, I'm a pressure patient. My worry now is whether the medical people, doctors and hospitals are doing everything possible to have essential drugs in Liberia. If flights are not coming to Liberia right now, frequently like before, and so on, what's going to happen to pressure patients who want to go get the drugs in the hospitals or in the drugstores and cannot find it, and then COVID-19 comes around you, then you will succumb very quickly. And quickly, I listened to a lady from the AIDS Commission one day when I was at the supermarket. And the superintendent of Montserrat County asked her, "Madam, how are you?" She said, "Fine." The superintendent asked her, "How is the place?" Which was the AIDS Commission. She said, "Well, fine. But the people have abandoned the place." In other words, those people from abroad who were supporting the AIDS Commission are not supporting the place anymore like before. What's going to happen after the AIDS patients in Liberia if there are no drugs, or HIV patients if there are no drugs to take care of them? Thank you.
Thank you, and hope our guests here have answered to your questions. I'm sure you understood him. He's talking about the AIDS Commission, that it has been abandoned. He also asked about some drugs. People now don't have these drugs coming in because of the delay in flights and all of that. So you can comment.
Thank you very much for the question. As it relates to the patients and COVID-19, especially those who are at high risk, as he rightly stated, you know that you have these existing conditions. you have to visit your physician regularly. And if you cannot find the drugs that you are taking, your physician should be able to advise you. You have many classes of hypertensive drugs. It's the same pressure drugs. You have many classes. So if one class is, in fact, within a class of drug, you have several drugs under that class. So if one drug is not available, the physician will know the drugs that are available and will advise you properly on which other drug you can switch to within that same class. If you're taking, for example, somebody taking Liberia, if the Philippine not around, you can take amlodipine if it's around. So within each class of drug, you have several. So all you have to do is left with the patient. In Liberia, the problem we have here is we not say we don't go to the hospital. And people should learn to start doing checkup regularly, because if you do your checkup regularly, the physician will be able to pick up something that you're not even complaining about, but that could be life-threatening to you. So for those who are at high risk, we will encourage you to visit your doctor regularly for advices. If you cannot find your medication, go to your doctor. Don't let anyone in the drugstore tell you, oh, take them. No, go to your doctor. The most you can do, the person in the drugstore, you can ask them to list the drugs they have. You can then take that list to your doctor, and your doctor will better advise you.
Okay, let's take this one as our last caller. Hello?
Yeah, hello.
You're live.
Yeah, thank you. This is Mr. John D. Kula. I'm calling you from Batala, Bone County.
Go ahead.
I want to thank the director for the information he's giving. But my question has to do with these pregnant women from the rural villages who did not go to the waiting room that they invested near the clinic, and they having to stay home. If they deliver on this side, we understand that they have special fine imposed on them for not going to the waiting room, and they deliver home the patient at $3,500, $2,500. My question is, if they do pay this money, who that money is, who responsible to receive that money, government or the clinic?
You don't pay that money, eh?
Yeah. I have paid it.
Okay, I see. Yeah, she will respond to you. Thank you for calling. Okay. You would like to respond to that?
Oh yes. So this question, every county in Liberia has a county health team, and the county is made of different districts. We just said that we've tried Ministry of Health to prevent or to discourage home delivery, because we are all finding means on reducing our already high maternal mortality.
Sure.
So I do not know which district he's in, but every district also has clinics, and these clinics have catchment areas. And if the midwife is in that clinic, she's responsible for certain areas, and she says, bring your pregnant woman at this waiting room. So these are all strategies they are putting in place. The first caller was concerned on what's happening if the pregnant woman stays in the community. The county, through the Ministry of Health, have different strategies on helping pregnant women reaching the facility and meeting skilled birth attendant. So I just want to encourage him to kind of go according to the law that says bring the pregnant woman at the waiting room, and the skilled birth attendant, the midwife, the nurse will be there and monitor them, like Dad is saying, if there are even complications that may not be observed by you, your husband, your spouse, while you are there under the supervision of the skilled birth attendant, that could be identified early, and then the referral pathway could quickly be also arranged. So I cannot answer from here what is happening with the 3,000, but I do know that the counties work collaboratively to try to discourage certain things. So they do not want you to pay that money. So can't they do what is right to save somebody's life?
Okay, so oh,
You know, first of all, the essence of the waiting home. The essence of the waiting home is to have pregnant mothers who live very far away from the health facility to come nearer to the health facility. Because when she's in labor, most of the time labor occurs at night. And she lives very far, most of those areas, they are not passable for cars. So to relieve that burden of having to travel long distances, the maternal waiting home is there to keep them there, well, especially when they're in their ninth month or when they're almost near delivery. They are advised to come into that waiting home and be there for monitoring by the midwife in the health facility to make it easier for delivery. That's the essence of the maternal waiting home. In that way, it can help to reduce maternal mortality because nobody knows who's at risk, who will develop complications in pregnancy. Nobody knows. It doesn't mean because I've had 2-3 children, the fourth child, my pregnancy will just be smooth. No. Everyone is a potential risk. Once you are pregnant, the tendency for you to experience some complications during our pregnancy is there. Okay. Now it comes to the money issue. Every community, most communities come up with their own laws. Most of the things is not the health people. I worked in the community. I worked in the interior before. I worked in the interior for 10 years. Most of the communities, they come up with their own protocols, their own decisions, and these decisions, the very community members are the ones who make them. It's not the health workers. So when it comes to that money does not go to the health worker. It is their own community leaders who design that strategy, and so he has to go to his community leader to do follow up on it.
Okay, so we're wrapping up now. As you would just like to take a minute to, close up. Probably you just want to let something out as your final word.
Okay, thank you for having us, and I want to use this platform to extend thank you to all nurses and midwives in the Republic of Liberia. As we know, this year has been tough. This year is actually the year of the nurse and midwife. 2020 is globally celebrated. However, while we were celebrating, it was time for us to tighten our belts to fight COVID. So I say thank you to all of you out there for upholding the code of ethics that usually will take you through your daily activities. And I've also come to plead with people who slightly sometimes forget to please be on par, because the public is looking at us to be more responsible, and accountable for what we do. Thank you very much.
Thank you, Dr. Birch.
Thank you very much for allowing me this opportunity. I'd like to extend my thanks and appreciation and encourage all health workers to continue doing what you're doing, most especially as we fight COVID-19. Remember, we are here with you. To those who have lost their lives, may their souls rest in peace and God console their families. To those who are ill, we pray to God that you have a speedy recovery. I also want to take this time to thank the government of Liberia for making health workers salary current. Some people complaining they're not taking pay, but for the health workers, I want to commend the government and to continue to do what they are doing. And to the entire public, I want all of us to know that COVID is real. It is here. It is in Liberia. Please adhere to the health protocols. Wash your hands frequently. Wear your mask. Observe the social distancing. Whenever you are coughing to your elbow or cough into a tissue paper, and get rid of it and get to the nearest hand washing point and keep washing your hands at all times. To the entire Liberian people, thank you all for your support as we strive to improve our health system, and thank you to the EWCT for having us on the show.
Welcome. Thank you too, Dr. Birch, for coming. That's the chairperson of the Liberia Medical and Dental Council, Dr. Linda A. Birch, and earlier was Madam Cecelia C.K. Flomo, the Registrar of the Liberian Board of Nursing and Midwifery. They've been our guests on this edition of the Bumper Show.